All right, good morning, everyone. Welcome to our Wednesday morning COVID-19 press briefing. I'm Carrie Schutte. I'm the Public Information Officer for Shasta County Health and Human Services. We'll start out as we sometimes remember to do with the numbers. As of today, we have 34 confirmed cases, including none from today. Our most recent one, I believe, was on Saturday. We've had 3,146 total tests to date. We've got 1 person in isolation and 9 in quarantine right now. And we are in stage 2 of our reopening plan. And the governor said that that about 70% of businesses are open statewide. So we are moving right along, which is, I think, feels good. I wanted to do our introductions. Right now we've got Dr. Karen Ramstrom, our health officer. We've got Donnell Ewert, the director of Shasta County Health and Human Services, and Matt Pontes is our CEO for Shasta County. And I see that Michael Vivakis has just joined us. Dr. Vivakis is our deputy health officer. From our hospitals, we've got Robert Folden from Mercy, who's singing some songs for us this morning. We've got Mark Mitchelson from Shasta Regional. We've got Jennifer Andrea from Mountain Valleys. Val Lakey from up in Bernie is not available to be with us today, but she sends her regards. And so I will open it up for any of you that I just mentioned to share anything that has happened in the past week that you would like for the world to know.
So good morning, everybody. I think we are at the beginning of this journey, and we're really pleased that we have not seen a bump in our numbers since we've begun reopening in Shasta County. We're really pleased with that early finding, and we'll continue to monitor it closely, but are optimistic. I did want to say that we hear the frustration of our community loud and clear about this reopening process, and recognize it's been difficult, and for everybody it's something new and is presented novel challenges that we're all learning as we go. And so I do want to reassure everybody that we're moving as fast as we can, as fast as the state order will allow us, and working every day with businesses and other sectors who are inquiring about and asking for assistance with that. And so our priority is to get our businesses open and doing that in a safe manner. And we're really pleased with the engagement of the community and making that happen. We do have a holiday weekend coming up, which is nice. We encourage people to get out with their loved ones and enjoy the outdoors, and that's really good for our mental health and our ability to connect with our families out in nature. We just really want to remind everybody to do that in a safe way. We all know what the rules are now, and please do and enjoy that holiday weekend. The other reminders, as we're opening up more and more, we want to encourage people to take steps to protect themselves. So when you're out and about in public, wear your cloth face covering, encourage your family and loved ones to do so as well. In addition to keeping, your physical distancing. We don't want those of us who are able to go out and about to get sick, and we also don't want to take that home to loved ones who might be more vulnerable. In addition, we're also recommending people take advantage of the state testing site out at Shasta College, particularly people as they're getting back out working and in areas where you might be interacting with the public. We encourage you to go out and periodically get tested, even if you don't have symptoms. So I think that's all I had today. Thank you.
Thank you, Doctor. Anybody else?
Thanks, Carrie. I've got a couple things. I just wanted to also express, that this whole COVID-19 has been very stressful and a big crisis for our community, as it has been in many communities across the country. And I want to appreciate what everybody's done to lessen the impact. We can't control the disease without participation from our community members. And so I just want to thank everybody, whether it be the average person who's been staying home or the businesses who have been complying with the orders from the governor. I also want to give my condolences to the families of those who have been lost, and also to those who have been gravely ill with COVID-19. I wanted to announce, and this probably isn't big news at this point, but we did end Unified Command last Friday, May 15th, and the command post is now being operated by Health and Human Services. We do still have the assistance of several sheriff's employees, including Anthony Bertain, who is the director of our EOC, the physical plant and the functional aspect. And Melissa Janilevich now is the sole incident commander. She is one of the branch managers within the Health and Human Services Agency. I wanted to make sure people are aware of the changes the state has been talking about in phase 2. And I think those were reported yesterday. And now places of worship can be used as office spaces for employees and for religious counseling. Curbside libraries are allowed, as well as drive-in movie theaters. And there's also planning going on by the state for additional openings in counties with variances. So we are one of those counties with a variance. We received the variance the first day they were granted, thanks to the hard work of Dr. Ramstrom. And those sectors, again, these are not open now. There's planning going on by the state for barbers and hair salons, the film and TV industry, places of worship, card rooms, and camps and schools. So those are some hopeful signs. We'll hopefully pass on more information as we get it. I know there was a call yesterday with the State Department of Public Health where some of these things are being discussed. I also want to remind businesses that you can get information from on guidance for your business on how to open with modifications that are safe for the public at shastaready.org. And if you have questions after reading the guidance on that website, you can send an email to covid19@co.shasta.ca.us with your questions. And staff will be responding to those. Thank you.
All right, thank you, Donnell. Anybody else have anything to add? Our hospital folks? Okay, if not, we will open it up to media questions. Do any of you have questions for our panel today?
I've got a question for one of my county friends. You guys can decide who wants to answer it, but based on the meeting yesterday, the supervisors meeting, could you reiterate or explain how the county may not be responsible totally for lifting these regulations, that it doesn't come just from the county?
I'd be happy to respond to that. And Dr. Ramstrom might have something to add, but I want to state again emphatically that everything that is happening is on the orders of the governor and the state health officer. Our local health officer has not imposed any restrictions greater than what the state has imposed. And so the protesters that were there yesterday, they may have legitimate concerns. Those should be directed toward the state government. It's the state government that has imposed measures on the state of California, not Shasta County. We are merely implementing and carrying out the orders that have been made by the state government.
Thank you.
Yeah, Donnell, you didn't mention, did you, timeline on those barbers, hair salons, churches, schools? That's the next step, but there's no solid date. Is that correct?
Well, in the governor's usual parlance, weeks, not months. That's all we know. But we do believe that there's probably going to be some, we believe that they're looking at something by the end of the month, but there really is no date ever given. And we usually have very little notice when they've finally made their decisions.
And would those be the latter part of phase 2, or would those be considered phase 3?
I believe it's phase 2 still. I haven't heard anything about phase 3, but Dr. Ramstrom may know more on that.
Yeah, I think that's, you know, what we've seen in writing hasn't indicated whether that's phase 2 or phase 3. Our sense is that might be additional opening up within stage 2, but we're not exactly clear on that either. I think we'll probably all be learning about that about the same time.
Other questions?
Do Donnell or Dr. Ramstrom, do you have any insight as to how the governor's office comes about these particular businesses in making these decisions? Is there some kind of rubric they're using to determine these? I mean, does he have a brain trust there in Sacramento that's figuring this stuff out on the fly?
Yeah, I think that they have several people who are having these conversations regularly, and I imagine there's so many different factors they're taking into consideration. There are some frameworks out there that help to assess risk of exposure and acquiring COVID-19, and I think that they've applied that rubric, and that's why they started with the low-risk businesses in stage 2. I think in addition, they're hearing from the counties and on some of our state calls, the questions that they get from various local health officials, as we're hearing from our community members, that you know, hearing about other ideas and suggestions for businesses or sectors that we should consider, because there's many more than fall into the big buckets, and so I think they're taking all of that into consideration. And then as they hear about strategies that have been used in other areas in order that, you know, might be used to do some of those activities safely, I think all of us, you know, nationwide are learning. And I think the governor's office is likely taking all of that into consideration.
Mike, it looked like you might have a question.
I do have a question for Robert and Mark. What's the status now on allowing visitors in to see your patients?
Well, for us, it's relatively unchanged, Mike. So we're still allowing up to 2 visitors a day, 1 visitor at a time. And then I think we're in the process of, you know, timing of, up to this point, we've said on a patient's discharge, you know, we've asked family members to meet their loved one outside. But I know there was a recommendation put out recently that we're now going to allow folks to come in upon discharge. We haven't implemented that piece yet. So we just want to make sure our staff are aware first. But I kind of want to echo what Donnell and Dr. Ramstrom have said up to this point. You know, I guess part of what we're asking is for folks not so much to humor us, but work with us, because this is a pandemic. This is an event that's somewhat outside of our control, and we have many regulatory and government agencies that are providing oversight with the public's best interest in mind. This really isn't. I understand how sometimes people can feel that their freedoms are being infringed maybe, but this really is about trying to stop a disease that we don't know much about. So work with us. We're not trying to do anything, you know, behind the scenes or whatnot. And I will tell you that the conversations we have off camera and the conversations we have locally in our building, it usually looks like me pressing our infectious disease experts, when are we going to open the cafeteria to the public? When are we going to allow more visitation? When are we going to allow our beloved volunteers to come back and help us with part of our operations?
And to answer your question, Mike, for us, it's continuously, just like Robert was saying, we're slowly opening it back up to the community. For us, we are limiting it to one person if the physician believes that this is important for the patient's care. So it's still kind of a one-off basis depending on what's going on with the patient itself. But we are beginning to open up to visitors slowly.
Thank you, guys.
And hopefully people heard that we are in the process. I know SRMC has already participated. We're in the process of having our students come back so that they can finish their training. And again, it's all under very coordinated, very defined parameters.
Good morning. I have a question regarding the, there's a lot of pressure on the Board of Supervisors from people in each of those districts. And it's, I know there's a letter, an advocacy letter that was sent to the governor. And then at yesterday's meeting, there was some pressure for the CEO to actually call the governor, even given instructions during a board meeting how to do that. Would any of those actions actually matter? Or is it just an exercise in futility to make the people in the districts feel like something is happening? I mean, could you actually sway the governor with a letter of advocacy or by calling him on the phone?
This is Matt. Thanks for the question. You know, I appreciate all the different ideas that the supervisors and the public and everybody has to help Shasta move forward in a safe and productive manner. And so, you know, to your question, we have a lot of different advocacy groups. There's an association of county administrators, and we're on the phone every single week talking about how we're leveraging our counties collectively and trying to make sure that the governor's staff and the governor himself understand all the challenges. And as we've talked a lot, the challenges that we have in North State are a little different than some of those real urban environments. And so we have an association of counties is another group that is in discussions almost every week, and how we leverage, you know, the collective elected officials and the county executive officers together to really try and push information back to the governor's team on how we bring about some of that change. So, you know, do I think that one call from one CEO in out of the 58 counties is gonna sway them either way? Probably not, but you know, anything's worth a try at this point. And again, you know, we feel as though some of our conditions are a little different here in this part of the state. I know the governor and their team have been recently, more recently than in the beginning, working on trying to allow for those different things. And you guys were able to see how we, our health officer attested that we met certain criteria and moved the ball forward on phase 2. And we know that within the next week or two, that we're probably having a chance to go a little further. And we'll look at what that means for Shasta County, and we'll attempt to move that forward. So back to your question, we're definitely going to try every avenue to make sure that the governor and their team understand the conditions here in Shasta County and in the North State, and be advocates for businesses to open in a safe manner that we feel have met our recommendations for social, being out there. So hopefully that helps answer your question.
Yeah, thank you. And a follow-up, would you see, do any of you have anything to say as far as Modoc County as sort of being a cautionary tale for the rest of the counties in California who maybe want to go faster sooner than we should?
So, you know, when Modoc County moved forward, you know, with 0 cases up in Modoc County that they had detected at least, you know, a lot of us in the other counties were, you know, hooray, somebody's going forward. Let's see what happens, you know, and let's see if how the governor and their office interact with Modoc County. And I can tell you, it definitely has been a cautionary tale. And I think everybody wants to get back opened up. Everybody has that feeling of the pressure, but wants to open up in a safe manner. And a lot of CEOs up and down the state, you know, we're in a lot of conversations on Modoc County, and we know that based upon our conversations here in Shasta County, with our businesses, our attestment into moving into a further part of stage 2 that was held off for a couple more days because the governor was upset about the Cottonwood Rodeo here locally. We know that the state is definitely watching all the counties, definitely paying attention to who's following state orders and not. And like we mentioned yesterday at the board hearing, even in the governor's May revise, there's language in there that talks about counties following the state orders, and if you're not following the state orders, that your allocation of state sales tax and other funding is at jeopardy if you're not following those state orders. And so, not only from a reimbursement perspective, but also from new income coming into the counties, it's all being jeopardized for those counties that are not following state orders.
Thank you, Matt. Are there any other questions? You guys are making it easy on us today.
I see
Go ahead, Dawn.
I see Michelle's light is on, so I was kind of waiting. Did she want to go first?
Her light's been on since she's been here, so I'm not sure. Michelle,
Okay.
question?
Okay, I have one more question. It's regarding churches. It's regarding churches. In Butte County, there was the church where there were 180 parishioners who were exposed possibly to an infected person in the congregation. And so Butte County is taking care of that. But here in Shasta County, there are a number of churches who opened up May 1st, and some opened up on Mother's Day, and yet others are promising to open up on the 31st for Pentecost Sunday. I think that's what it's called. Anyway, so if you know of churches, is it a situation like just wait and see and look the other way, even if you know church services are happening, and just deal with it if there's an infection, and otherwise not do anything about it?
So, I guess I would say we have our roadmap to recovery advisory committee, and we have a representative who's working with the faith community and talking with them regularly. And we're providing him with some support and information as we learn and can pass on what we know is allowed and those kinds of things. And so, I think what we really look to the leadership in the faith community to do what is recommended at this time. Mass gatherings are our greatest concern, and as far as disease spread, and our hope is that those entities will hold off for a bit until we can do it in smaller groups in a manner that's safe, so that we can actually allow some time for our business community and other related sectors, such as childcare, to get going. And so we can make sure we can do that safely first, and then go slow with those, settings where you have more people meeting and gathering together, such as in a church setting. So I guess if we heard specifically about some gatherings that were happening, then we would reach out to the leadership in those entities. And I'm not aware that we've been notified of any particular events that have happened or are planned.
I'd like to comment about the faith communities as well. And I just, again, I think we have over 400 faith communities in Shasta County, and faith communities are fabulous for health. It's actually very good for your health to be part of community groups. It could be a faith community, it could be a club, it could be an organization where you volunteer. These are really great for our community, and we value them tremendously, and we've been very grateful for their support during this crisis and changing their practices dramatically and not meeting. Just like any other sector, we really want to see a reopening that is thoughtful and planned and taking into account proper modifications. So for faith communities just to open up and begin to function like they did previously, that would be really detrimental to our community and create opportunities for spread of disease. And in fact, we've had our own issue with transmission in one faith community here in Shasta County, and that we don't know exactly how all that happened, but folks know each other in churches and other faith communities, and if they're interacting both in the facility or outside, it can cause transmission. So, and then they pass it on to their other members. So a faith community can experience an outbreak by not following appropriate recommendations. And I think there's one church in Arkansas that had quite a large outbreak and several deaths. And I'm sure no faith community wants that to happen to the members of their own community. Also, many of these faith communities have elderly members who are in the high-risk population, and that poses a risk to them. So I think the state is actually pondering all of this and trying to think through how faith communities can begin to reopen with modifications. And I think one of the first steps would be small groups. And small groups are important because if there is a case in a small group, it limits the number of people exposed. And so that might be a first step. I think face coverings are going to be important. There was an outbreak at a choir rehearsal in Washington State earlier in the COVID-19 outbreak, where one infected person infected, I believe, more than 3/4 of the people there over a 2.5-hour choir rehearsal. So singing does project droplets, and singing is popular in churches. So, face coverings would be another issue. Another great idea we've heard is having people sign in when they attend a service, which makes contact tracing easier if there is a case identified that was present in that group. Then we can more easily follow up with people who may have been exposed. So there's a lot of ideas and a lot of concepts that we really need to try to put in place before faith communities can get back and running again, which we all want. So we're hoping that our faith communities will continue to partner with us and be methodical and cautious about their actions, and wait for the green light from Sacramento and with the guidance that will come out associated with that, so we can do it in a way that is protecting their members as well as our community.
Now that the Unified Command is disbanded, and Health and Human Services is in charge, would it fall upon Health and Human Services to make the decision about whether to enforce and how to enforce the gatherings ban?
Health and Human Services is part of the county. So there's a lot of county officials involved in providing input on the enforcement question. And I think it's been made fairly clear that nobody wants to see people cited, arrested, fined for violating the stay-at-home order. What we really want is the community to rally around our common goal of keeping our community safe and voluntarily complying with the order. We're going to take an approach of talking to people, trying to mitigate risk. I don't think you're going to see anybody arrested or cited for violating the order.
So Michelle is having audio troubles, but she did send me her question. I think, Donnell, that you did touch on part of the answer, but she asked what might be done about the growing number of health clubs that are opening. Is there anything that you or Dr. Ramstrom or Matt might want to add to?
One of the principles, that we've been interested in is a level playing field for businesses. And I think we've made clear that getting businesses open and people back to work is one of our highest priorities, because we have a health crisis and an economic crisis. And I just parenthetically want to add, a financial crisis for business is a financial crisis for government. if anybody is under the impression that we get a charge out of restricting businesses, the truth of the matter is our government revenue is dependent on business. And the better business does, the more revenue we have in government. And so our revenues are in sharp decline. A lot of the revenues that support my agency are down, are projected to be down 15% for the current budget year. So it is not in our interest either for business to suffer. So we are very interested in business getting back and running again. And so we have every interest in trying to get folks going, and that's why Dr. Ramstrom was so quick with the attestation, and why we were in the queue so quickly with that, try to get as many businesses open as we could in stage 2. Gyms are in stage 3. They're a stage 3 business, and they're a high risk business because of several issues. Sometimes there's group activities in smaller rooms, and there's a lot of machines that people are touching, and trying to keep all that sanitary, and also people breathing hard around each other is similar to that singing issue I brought up earlier. So these are reasons why the gyms are considered high risk, and they're in stage 3. Now, so we do know that gyms have opened, some of them, and this creates an uneven playing field for the ones that are complying. So we're concerned about that. And again, we make an appeal to all of the gyms that have open, and we ask them to close because they should not be open at this time. And we want to give kudos to the gyms that have remained closed. And what we do ask is that the public exercise outside by themselves or in their family groups. We do want people to exercise. The weather in Reading is pretty good. We had a little rain here the last week, but generally speaking, we've got great weather to go out and walk, run, cycle, and take advantage of the outdoors to exercise. Let's hold off on using the gyms until we get the green light on stage 3.
So now, other questions?
I've heard some speculation about Waterworks Park. Are they opening? Do they have permission to open? And if so, how do they fall into a category that they can? Some of the speculation I've heard is the chlorine kills the virus. I don't know. Can you comment on that, Dr. Ramstrom?
Sure. So we've been working on and conversation with Waterworks Park, and they are not open, and they are not a business or an entity that would be considered safe in stage 2. So we will continue to work with them to make sure that that's clear. So it would involve, a lot of kids, close together, and regardless of the water. And so the water isn't the concern, it's the gathering and the close activity, kids playing in the water together, and that, it's not necessarily an activity that's built to socially distance. And so it's just not something that is considered safe to open up quite yet.
I guess that was just a rumor. Thank you.
Any other questions? Okay. Thank you, everyone, once again for being with us. We will be back again next Wednesday at 11 a.m. and the same place. Thanks very much, and have a safe and healthy day.